So good morning friends, I'm going to present on topic today, muscle soreness. Okay, mainly I'll be talking on delayed onset muscle soreness lah. So first, what is muscle soreness? Okay, we have heard about sore eyes and everything, right? So muscle soreness, you basically swollen muscle lah. So there is two actually, acute and delayed phase lah. So this acute one usually happens after the exercise, 1 to 2 hours after exercise lah. So results from the accumulation of end products, which is hydrogen, and also because of the tissue edema. So that is acute muscle soreness. So if we see delayed onset of muscle soreness is basically it's a type 1 muscle strain, can be classified as type 1 muscle strain, and also it associated with pain lah. So when there's a soreness, of course there will be a pain. So this one will happen 1 to 2 days after heavy exercise. So not right after, but it's that's why it's called as delayed. So primarily because of eccentric action and also associated with actual muscle or tissue disruption damage lah. So actually it's because of the exercise I have mentioned about eccentric, concentric and static. So mostly it affect more on eccentric type of exercise lah compared to the other static and concentric. So what is the causes of causes of DOMS lah? So it's a proposed causes of DOMS actually. So there's actually 3 here, 1, 2, 3. So if you see here, it's actually interlinked lah. So it's related lah, one and each other. So if you see the first one is mainly talks about the structural damage, the muscle itself lah. So it's because of the strain from the connective tissue, and also because of the high tension in the contractile elastic system of muscle. So when the one I mentioned was strain of from connective tissue is the muscle, the connective tissue covering the muscle itself lah. And the high tension is because like high tension in the contractile elastic system lah. Okay, this will cause damage to the muscle and also the cell membrane. Okay, the second one is impaired calcium homeostasis lah. So I have mentioned last 2 weeks about the calcium giving contraction. Calcium plays an important role in contraction of skeletal muscle. So in this case, there will disturbs the calcium homeostasis lah in an injured fiber. So it will inhibits the cellular respiration lah. So which will this increased calcium concentration will activate the enzyme, will degrade the Z line. So the Z line, last 2 weeks I've mentioned about the Z line as well lah. So Z line is a structural support for transmission of force when muscle fibers activated to shorten. So that's the function of Z line actually lah. So what will happen if too much of calcium will degrade the Z line lah, so will disrupt the Z line. So that it's about the impaired calcium homeostasis. The third one is about inflammatory response. So can have muscle injury because of that. So increasing circulating neutrophils lah, involving an inflammatory response. So what is function of neutrophils? Okay, one, if any foreign bodies, it will try to react by releasing cytokine. The second one, if we see any tissue, if any other abnormalities in the tissue area, tissue site, it will try to react by by releasing out the cytokine. So what will happen is that the products of macrophage, okay, this is the what will happen after the cytokine release, and then the macrophage will come and invade, and then it will have the process of phagocytosis. Okay, products of macrophage activity and intracellular contents like histamine, kinase and potassium will accumulate outside the cell. So these products all will stimulate the free nerve endings in muscle, and this will cause pain. So that is how the pain is how the pain is really this one lah. So what else can lead to DOMS besides the 3 factors that I said? Edema with or without muscle injury. So it's independent or without lah, I mean independent or dependent on the muscle injury lah. So the fatal fissure is the accumulation of interstitial or intracellular fluid, will cause more tissue fluid pressure within the muscle compartments, and this will cause activates pain receptor within the muscles lah. So few, I think I have mentioned about pain nerve fibers that innervating the muscle. So yeah, in previous presentation. So DOMS and performance wise lah. So when you have this DOMS, so automatically you will have a reduced force generating capacity lah of a affected muscle. So what is the factors involved is there's a three actually: physical disruption of the muscle itself, okay, which is the structural damage lah, and the second one is the failure within excitation contraction coupling process, which I have mentioned also what is that excitation contraction coupling previously, and also loss of contractile protein. So contractile protein is myosin, actin, troponin, promycin, all that lah, okay. So this is the graph actually lah, drawn actually. So it's related to the it's related to the so this is a graph. So on the y-axis is the strength loss, and the x-axis days after injury lah. So it's based on the factors involving lah. So it's EC coupling failure, contractile protein loss, and physical disruption. So on day 0, so what are the main factor that causing the strength loss? So the highest one is the yellow color. Yellow color is the physical disruption lah, okay, and followed by the blue one, which is the EC coupling failure, okay, and then the rest is like the day 3 is all the same lah, almost like the highest here is the yellow one lah, physical disruption of the muscle, and it goes on until day 28 lah. So okay, so how to reduce this negative effect of DOMS? So basically you need to reduce the eccentric component in the early training, okay, and then the second one, start the training at very low intensity, and you progress slowly through the first few weeks lah, okay. Then third, initiate with very high intensity, very exhaustive training lah. So this is the important actually factors associated with DOMS important in stimulating muscle hypertrophy, hence maximizing the training response lah. So yeah, that's all for DOMS.